today's class, I'm going to cover the science about how stress and traumatic experiences negatively impacts our brain function and our health, and actually is likely to cause most of the chronic diseases of today. So I'm going to specifically cover the science that is showing us that stress turns off the prefrontal cortex. And this is, of course, very relevant to us chiropractors because we know that we can impact the processing of the prefrontal cortex when we adjust subluxations. So it's therefore very important that we understand this science about how stress turns off the prefrontal cortex and how chiropractic can change the processing within the prefrontal cortex. Because the prefrontal cortex, remember, it's vital for one's intelligence, all movement control, so motor control, pain processing, mental health, immune system, and inflammation levels, and therefore all of the chronic diseases of today. So the prefrontal cortex basically makes you who you are. And if stress changes that in a really big way. So we're going to talk a lot about stress and how it impacts the brain in general, but also specifically how it impacts the prefrontal cortex. Right, I'm going to start today's class by listing all of these super important vital functions of the prefrontal cortex. And then I'm going to go through exactly how the prefrontal cortex normally functions or how the brain normally processes non-stressful information. And then we're going to look at how stress impacts the way the brain processes information and how you can easily explain this to patients or friends or family or the public. And one of the easy ways to explain how stress impacts the prefrontal cortex and the limbic brain is using this hand model. So that's what I'm going to go through. This hand model was made very famous by Dan Siegel, a psychologist. So that's the hand model that I'm going to go through and explain for you. We'll then have a look at how stress alone can cause subluxation. So we're kind of linking it back to chiropractic as well, because stress shuts down the prefrontal cortex, but it also causes subluxations. So really interesting, and no wonder then when we adjust subluxations, we impact the prefrontal cortex. That all makes sense. I also want to cover what types of stress I'm actually talking about. So we're going to focus a bit on traumatic experiences and the kind of, fight and flight response that this can trigger. And there's been a major focus on this in the neuroscience literature over the past few decades. So there's been a major growth in our understanding about that. So I want to cover a bit about that. And then I'll talk you through exactly how stress shuts down the prefrontal cortex and boosts or strengthens the limbic brain functions. And then I'll go on to how to make it easier for you to recognize stress symptoms in your patients. We'll talk a bit about the stress scale and how different symptoms can appear at different times, over many years of chronic stress. And then I'll finish off this class by going over the strong links between stress and inflammation and most of the chronic diseases today. Because stress is probably today's number one killer because it's responsible for this increase in inflammation levels.